Hello, everybody. This is Monica Heltz with your daily Fishers Health Department update. Just a couple of topics for today. One is about masks. So I'm not going to go into the great details and the finer points of the difference between K95, N95, surgical masks, and cloth masks. Indy Lane, our great health officer, Dr. Lane, has already done that just as recently as last week. So I would direct you to her most recent video if that's a topic of great interest to you. But I do want to mention that the masks with valves are not doing a great job of protecting other people because they're letting your potential viral particles out. So if you have another mask that you can wear around others, that's going to be more beneficial for protecting our community. So as you're looking at masks, or if you're looking to buy any on Amazon or wherever you buy your mask, I would say please do not select one with a valve. The other thing to know is that if you're wearing a cloth mask, the better masks are going to have more than one layer. So as you're choosing your masks, again, the more layers it has, at least 2 layers, the more protective it's going to be for others around you, which is really the purpose of wearing that cloth mask, is to protect the others around you. So when you're selecting your mask, try to select ones that have more than one layer. The other thing I wanted to cover today was high-risk groups and recommended activities for those high-risk groups. So if you're in a high-risk group, you may know it or you may not know it. So those of you who would be considered at extra high risk for complications of COVID would include people over the age of 65, people who have diabetes. If you have high blood pressure, that would put you in the high-risk group. We know that COVID affects the heart, particularly, and some of the vessels. If you have heart, lung, kidney, or liver disease, you would be considered at a high-risk group. If you have any kind of neurological condition, such as Alzheimer's or dementia or something like that, then COVID may exacerbate that condition. If you're generally immunocompromised, and usually you know who you are if you are, that would include people with cancer, people on immunosuppressant medications, such as the TNF alpha inhibitors and some other medications that lower your immunity to specific diseases, and people with organ transplants and that kind of thing. The final risk group I want to talk about is obesity. So obesity as a risk group is defined as having a BMI of greater than 30. So a BMI is a body mass index. You can find out what your BMI is by doing a simple Google search for BMI calculator, and you will find lots of opportunities to calculate your BMI. There's also phone apps that you can put on your phone to figure out what your BMI is. It's just a simple calculation between your height and your weight, and if those things are if your weight is higher than is recommended for your height, then your BMI may be a bit up. So if your BMI is greater than 30, you may be considered a high risk group for COVID. So in that case, if you fall into a high risk group, our activity recommendations for you are going to be a little bit different than they're going to be for the rest of our community members. And that's, again, just a recommendation for your own safety and wellness. So we have those spelled out in our community risk rating tables on our website if you want to read more. But as we're going into the holiday weekend and thinking about Labor Day, making your plans, I really would strongly urge you to not go to any parties if you're in that high risk group. In the yellow rating, we don't recommend that you hang out with more than 8 people if you're in a high risk group. And in the orange level, it really should not be more than 2 people. So as you're making those plans, please know that we're on the yellow, really headed to orange. We're awfully close to orange if we're not already in it. So again, I would urge extreme caution. If you have been shopping at the grocery store, you may consider going to curbside pickup and using or delivery, and using some of those other kind of tactics that we were all trying to manage with early on when everything was shut down. So I guess the message is that we know we're experiencing increased community spread, and that spread particularly is among the late teen to early 20-year-olds, who often tends to be the workers in service industry and things like that. So if you can minimize your exposure, then that will keep you a little bit more protected. So hope this is helpful. Stay safe out there and keep wearing your masks. Take care. Bye.